Question 1. The monitoring system demonstrates an intermittent and unexplained fluctuation in the recorded radiation dose delivered during an interventional radiology procedure, raising concerns about its accuracy. What is the most appropriate immediate course of action? Option A. Complete the procedure and then report the monitoring system anomaly for subsequent review. Option B. Continue the procedure while making a mental note of the fluctuation for later reporting. Option C. Proceed with the procedure, relying on the radiographer's visual assessment of image quality to compensate for potential dose inaccuracies. Option D. Immediately cease the procedure and initiate a comprehensive investigation into the radiation dose monitoring system's performance. Correct answer is D. Immediately cease the procedure and initiate a comprehensive investigation into the radiation dose monitoring system's performance. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the interventional radiologist to balance immediate patient care with the long-term implications of equipment malfunction and regulatory compliance. The unexpected fluctuation in the radiation dose monitoring system introduces uncertainty about the accuracy of delivered doses, potentially impacting patient safety and the integrity of the procedure. The challenge lies in making a swift, informed decision that prioritizes patient well-being, while adhering to the stringent safety protocols mandated by the European Board of Interventional Radiology (EBIR) framework. Correct approach analysis. The correct approach involves immediately ceasing the procedure and initiating a thorough investigation of the monitoring system. This aligns with the EBIR emphasis on patient safety and the ALARA, as low as reasonably achievable, principle for radiation exposure. Regulatory guidelines, such as those pertaining to quality assurance and equipment performance in medical imaging, mandate that any deviation from expected operational parameters must be addressed promptly. By stopping the procedure, the radiologist prevents potential over- or underdosing of the patient, thereby upholding the ethical obligation to provide safe and effective care. Furthermore, initiating an investigation ensures that the equipment is recalibrated or repaired, preventing future incidents and maintaining the overall quality of care within the institution. This proactive stance is crucial for maintaining patient trust and adhering to professional standards. Incorrect approaches analysis. One incorrect approach is to continue the procedure while making a mental note of the fluctuation. This is a significant regulatory and ethical failure. It disregards the fundamental principle of patient safety by knowingly proceeding with a procedure where the radiation dose monitoring is compromised. This could lead to inaccurate dose reporting, potential patient harm due to incorrect exposure, and a breach of quality assurance protocols. It also undermines the integrity of the EBIR commitment to evidence-based practice and patient protection. Another incorrect approach is to complete the procedure and then report the monitoring system anomaly for later review. This is also professionally unacceptable. While reporting is necessary, delaying the assessment of the anomaly until after the procedure risks exposing the patient to potentially harmful radiation levels without immediate mitigation. The EBIR framework prioritizes immediate action when safety is compromised. This approach fails to address the immediate risk to the patient and could be interpreted as negligence. A third incorrect approach is to assume the fluctuation is a minor glitch and proceed with the procedure, relying on the radiographer's visual assessment of image quality. This is a dangerous oversimplification and a clear violation of safety protocols. Relying on subjective assessment over objective monitoring data is not in line with the rigorous standards expected in interventional radiology. The monitoring system is in place to provide quantitative data, and its malfunction requires a systematic, not a dismissive, response. This approach neglects the importance of calibrated equipment and accurate dose measurement, which are cornerstones of radiation safety as outlined by EBIR. Professional reasoning. When faced with equipment malfunction during a procedure, the professional decision-making process should follow a hierarchical approach prioritizing patient safety. First, assess the immediate risk to the patient. If the malfunction directly impacts patient safety, e.g., radiation dose monitoring, the immediate priority is to mitigate that risk. Second, consult relevant institutional protocols and regulatory guidelines, in this case EBIR standards. These provide the framework for acceptable actions. Third, communicate the issue to relevant personnel, e.g., radiographer, physicist, supervisor, to facilitate a collaborative and informed decision. Finally, document all actions taken and the rationale behind them for quality assurance and potential future reference. The decision to stop the procedure and investigate is a direct application of this reasoning, placing patient safety and regulatory compliance above the expediency of completing the procedure. Question 2. The control framework reveals that the integration of interventional radiology, services into modern European healthcare systems is often characterized by diverse national implementation strategies and varying levels of resource allocation. Considering the EBIR commitment to advancing IR practice and patient care across Europe, which of the following strategic approaches best optimizes the role of IR in modern medicine, ensuring both clinical efficacy and systemic integration? Option A. Advocating for increased departmental autonomy within individual hospitals to manage IR resources independently, without necessarily coordinating with broader regional or national healthcare planning initiatives. Option B. Prioritizing the expansion of IR services based on the perceived prestige of certain complex procedures, irrespective of their established clinical utility or cost-effectiveness compared to alternative treatments. Option C. Developing a comprehensive strategy that emphasizes interdisciplinary collaboration, evidence-based service expansion, and proactive engagement with health policymakers to demonstrate IR's value in improving patient outcomes and reducing overall healthcare expenditure. Option D. Focusing primarily on acquiring the latest IR equipment and technologies to enhance procedural capabilities, assuming that technological advancement alone will drive service integration and patient demand. The correct answer is C. Developing a comprehensive strategy that emphasizes interdisciplinary collaboration, evidence-based service expansion, and proactive engagement with health policymakers to demonstrate IR's value in improving patient outcomes and reducing overall healthcare expenditure. Explanation. The control framework reveals the evolving landscape of interventional radiology, within the European healthcare system, emphasizing its crucial role in modern medicine. This scenario is professionally challenging because it requires a nuanced understanding of how IR services are integrated, funded, and regulated across diverse European Union member states, impacting patient access and quality of care. The challenge lies in optimizing resource allocation and service delivery to meet increasing demand, while adhering to varying national guidelines and the overarching principles of European healthcare directives. The correct approach represents best professional practice because it prioritizes a patient-centric model that leverages IR's minimally invasive nature to improve outcomes and reduce healthcare costs. This aligns with the European Board of Interventional Radiology, EBIR, objectives of promoting high standards of practice and patient safety. A proactive strategy that involves interdisciplinary collaboration, evidence-based service development, and engagement with health policymakers ensures that IR services are recognized for their value and are adequately resourced. This approach fosters continuous quality improvement and facilitates the adoption of innovative IR techniques, ultimately benefiting patients by offering less invasive, more effective treatment options. Adherence to EBIR guidelines and relevant EU directives on patient mobility and healthcare quality is paramount. An incorrect approach that focuses solely on the technical aspects of IR procedures without considering their integration into broader patient pathways fails to acknowledge the holistic nature of modern healthcare. This oversight can lead to fragmented care, suboptimal patient outcomes, and inefficient resource utilization, potentially violating principles of integrated care and patient well-being. Another incorrect approach that neglects the economic realities and funding mechanisms for IR services risks the sustainability of these vital treatments. Without a clear understanding of reimbursement structures and the economic benefits of IR compared to traditional surgery, services may be underfunded, leading to reduced access and potential disparities in care across regions. This can contravene EU principles of equitable access to healthcare. Furthermore, an approach that disregards the need for continuous professional development and adherence to evolving EBIR standards poses a significant risk to patient safety and the quality of care. Failure to keep abreast of new techniques, safety protocols, and evidence-based practices can lead to suboptimal treatment decisions and adverse events, directly impacting patient outcomes and potentially violating ethical obligations and regulatory requirements for maintaining professional competence. The professional reasoning process should involve a thorough assessment of the current IR service landscape, identifying areas for improvement in terms of efficiency, patient access, and clinical outcomes. This requires engaging with stakeholders, including referring physicians, hospital administrators, and patient advocacy groups. A data-driven approach, informed by evidence and best practices as promoted by EBIR, is essential for developing strategic plans. Professionals must critically evaluate proposed service expansions or modifications against established quality indicators and regulatory frameworks, ensuring that all decisions are ethically sound, clinically justified, and economically viable within the specific European context. Question 3. During the evaluation of a patient with a complex vascular anomaly requiring intervention, which of the following approaches best reflects the process optimization required for selecting between an image-guided endovascular embolization and a traditional open surgical resection, considering European guidelines and best practices for interventional radiology? Option A. Selecting the treatment modality based on the availability of specific equipment and the personal experience of the interventional radiologist, irrespective of comparative clinical outcomes or patient-specific considerations. Option B. Prioritizing the endovascular approach due to its inherent minimally invasive nature and potentially faster patient recovery, without a detailed comparative analysis of long-term efficacy and complication rates against surgical options for this specific anomaly. Option C. Conducting a comprehensive review of the latest peer-reviewed literature comparing endovascular embolization and open surgical resection for similar vascular anomalies, assessing patient-specific factors such as comorbidities, anatomical suitability, and patient preferences, and engaging in a multidisciplinary discussion with surgical colleagues to determine the optimal treatment strategy. Option D. Recommending the surgical resection as the default treatment due to its established history and perceived definitive cure, without adequately exploring the potential benefits and risks of endovascular embolization for this particular patient. The correct answer is B. Prioritizing the endovascular approach due to its inherent minimally invasive nature and potentially faster patient recovery, without a detailed comparative analysis of long-term efficacy and complication rates against surgical options for this specific anomaly. Explanation. This scenario presents a common challenge in interventional radiology, comparing a minimally invasive, image-guided procedure with a traditional open surgical approach for a specific patient indication. The professional challenge lies in objectively evaluating the relative merits of each technique, considering not only clinical outcomes, but also patient safety, resource utilization, and adherence to evolving European guidelines for interventional procedures. The decision-making process must be grounded in evidence-based practice and patient-centered care, aligning with the principles of the European Board of Interventional Radiology, EBIR. The correct approach emphasizes a comprehensive, multidisciplinary assessment that prioritizes patient benefit and aligns with the principles of evidence-based medicine and patient safety, as espoused by European regulatory frameworks for medical devices and procedures. It involves a thorough review of the latest clinical evidence, considering factors such as complication rates, recovery times, long-term efficacy, and patient quality of life. This approach also necessitates collaboration with surgical colleagues to ensure a holistic understanding of both interventional and surgical options, fostering a shared decision-making process that respects the expertise of all involved disciplines. Adherence to EBIR guidelines, which promote the appropriate selection and application of interventional techniques, is paramount. Incorrect approaches fail to uphold these standards, focusing solely on the perceived technical ease of one modality, without a rigorous comparison of outcomes, neglects the fundamental ethical and professional obligation to provide the best possible care for the patient. Over-reliance on historical practice or personal preference, without incorporating current evidence or multidisciplinary input, can lead to suboptimal patient management and potential harm. Ignoring patient preferences or failing to adequately inform them about all viable treatment options constitutes a breach of informed consent principles, a cornerstone of ethical medical practice within the European context. Furthermore, a lack of consideration for the specific patient's comorbidities and anatomical suitability for either technique demonstrates a failure in individualized patient assessment, which is a critical component of responsible medical decision-making. Professional decision-making in such situations requires a structured approach. First, Clearly define the patient's condition and treatment goals. Second, systematically gather and critically appraise the available evidence for both interventional and surgical options, paying close attention to comparative studies and meta-analyses. Third, engage in open and honest communication with the patient and their family, discussing the risks, benefits, alternatives, and uncertainties of each approach. Fourth, consult with relevant specialists, including surgeons and other interventionalists, to gain diverse perspectives. Finally, document the rationale for the chosen treatment plan, ensuring it is clearly justified by the evidence and patient's best interests, in line with European standards of care. Question 4. The assessment process reveals a discrepancy in understanding the scope of interventional radiology among newly qualified practitioners. Which of the following best defines the scope of interventional radiology according to the European Board of Interventional Radiology (EBIR) framework? Option A. The performance of minimally invasive diagnostic and therapeutic procedures guided by medical imaging. Option B. Interventions that are primarily diagnostic in nature and do not involve therapeutic interventions. Option C. Any procedure that is less invasive than traditional open surgery, regardless of imaging guidance. Option D. Procedures exclusively performed by radiologists using fluoroscopic guidance. Correct answer is A. The performance of minimally invasive diagnostic and therapeutic procedures guided by medical imaging. Explanation. The assessment process reveals a common challenge in defining the boundaries of interventional radiology, EBIR, within the European healthcare landscape. This is professionally challenging because the rapid evolution of minimally invasive techniques means that the scope of IR is constantly expanding, potentially leading to ambiguity in service provision, training requirements, and professional recognition. Ensuring clarity on what constitutes IR is crucial for patient safety, resource allocation, and the development of specialized training pathways aligned with the European Board of Interventional Radiology (EBIR) standards. Careful judgment is required to distinguish core IR procedures from those that may overlap with other specialties, ensuring that patients receive care from appropriately qualified practitioners. The correct approach represents best professional practice because it aligns with the established definition and scope of interventional radiology as recognized by the EBIR. This definition emphasizes the use of image guidance to perform minimally invasive procedures for diagnosis and therapy. Adhering to this recognized scope ensures that practitioners are operating within their defined expertise, promoting patient safety and the quality of care. It also supports the EBIR role in setting standards for training and certification, which are vital for the consistent delivery of high-quality interventional radiology services across Europe. An incorrect approach that defines interventional radiology solely by the absence of open surgery fails to capture the essence of the specialty. This is a regulatory and ethical failure because it is an incomplete and potentially misleading definition. It overlooks the critical element of image guidance, which is fundamental to IR, and does not acknowledge the diagnostic and therapeutic applications beyond simply being less invasive than open surgery. This could lead to misclassification of procedures and a lack of appropriate oversight. Another incorrect approach that limits interventional radiology to procedures performed exclusively by radiologists is also a regulatory and ethical failure. While radiologists are often the primary practitioners of IR, the EBIR framework acknowledges that the scope of IR encompasses a range of minimally invasive image-guided procedures, and the definition is not strictly limited by the base specialty of the practitioner, but rather by the nature of the procedures themselves and the required expertise. This narrow definition could exclude highly skilled practitioners from other specialties who perform image-guided interventions and may not align with the broader European understanding and practice of IR. Finally, an approach that defines interventional radiology based on the specific imaging modality used, e.g., only fluoroscopy, is a regulatory and ethical failure. Interventional radiology utilizes a variety of imaging modalities, including ultrasound, CT, and MRI, in addition to fluoroscopy. Limiting the definition to a single modality is an arbitrary and inaccurate restriction that does not reflect the current practice or the comprehensive scope of interventional radiology as understood by the EBIR. The professional reasoning framework for similar situations should involve consulting the official EBIR guidelines and definitions. When faced with ambiguity, practitioners should prioritize definitions that emphasize the core principles of interventional radiology: image guidance, minimally invasive techniques, and therapeutic or diagnostic intent. They should also consider the established training pathways and competencies recognized by the EBIR. If a procedure's classification remains unclear, seeking clarification from professional bodies or senior colleagues with expertise in the field is a responsible and ethical step. Question 5. Process analysis reveals that an interventional radiologist is preparing to perform a complex percutaneous transluminal angioplasty on a patient with moderate renal impairment. The procedure is anticipated to require significant fluoroscopic time and multiple contrast injections. Considering the patient's renal status and the procedural demands, which approach to contrast agent selection best aligns with current European guidelines and best practices for patient safety? Option A. Administer a contrast agent without specific consideration for the patient's renal impairment, prioritizing procedural efficiency. Option B. Utilize a high osmolar, ionic iodinated contrast agent due to its lower cost and widespread availability. Option C. Select a low osmolar, non-ionic iodinated contrast agent, carefully monitoring renal function post-procedure. Option D. Choose a contrast agent based on the radiologist's personal preference from previous clinical experience, irrespective of recent guideline updates. The correct answer is C. Select a low osmolar, non-ionic iodinated contrast agent, carefully monitoring renal function post-procedure. Explanation. Scenario analysis. This scenario is professionally challenging because interventional radiologists must balance the diagnostic utility of contrast agents in fluoroscopy with the inherent risks of adverse reactions and potential nephrotoxicity. The choice of contrast agent is not a one-size-fits-all decision. It requires a nuanced understanding of patient-specific factors, the procedure's demands, and the available evidence regarding safety and efficacy. Adherence to European guidelines and best practices is paramount to ensure patient safety and optimal outcomes. Correct approach analysis. The correct approach prioritizes patient safety by selecting a low osmolar, non-ionic contrast agent for a patient with moderate renal impairment undergoing a complex interventional procedure. This aligns with current European guidelines for contrast media use, which advocate for iodinated contrast media with a lower risk profile in patients with compromised renal function. The rationale is that these agents have a lower incidence of adverse reactions and are less likely to exacerbate existing renal dysfunction compared to high osmolar or ionic agents. This choice demonstrates a proactive risk mitigation strategy, reflecting a commitment to evidence-based practice and patient well-being, which is a cornerstone of professional responsibility under EBIR framework. Incorrect approaches analysis. Choosing a high osmolar, ionic contrast agent for this patient would be a significant regulatory and ethical failure. High osmolar agents are associated with a higher risk of anaphylactoid reactions and osmotic diuresis, which can further stress compromised kidneys. This approach disregards established safety protocols and patient-specific risk factors, violating the principle of do no harm, and failing to adhere to the precautionary principle often emphasized in medical guidelines. Opting for a contrast agent without considering the patient's renal function, simply based on cost or availability, represents a failure in professional judgment and adherence to regulatory expectations. Patient safety must always supersede economic considerations. This approach neglects the fundamental ethical duty to provide individualized care and could lead to severe adverse events, including contrast-induced nephropathy, which would be a clear breach of professional standards and potentially lead to disciplinary action under the EBIR framework. Selecting a contrast agent based solely on historical practice without reviewing current evidence or guidelines is also a failure. Medical knowledge and best practices evolve. Relying on outdated information can lead to suboptimal or even harmful patient care. This demonstrates a lack of commitment to continuous professional development and adherence to the most current, evidence-based recommendations, which are implicitly expected within the EBIR framework for maintaining high standards of interventional radiology practice. Professional reasoning. Professionals should adopt a systematic decision-making process. This begins with a thorough patient assessment, including a detailed medical history, review of laboratory values, especially renal function, and identification of any allergies or previous adverse reactions to contrast media. Next, the specific requirements of the interventional procedure should be considered, including the volume of contrast likely to be used and the duration of fluoroscopy. Subsequently, the available contrast agents should be evaluated based on their osmolarity, ionic properties, potential for adverse reactions, and specific contraindications or precautions, particularly in relation to the patient's comorbidities. Finally, the decision should be made in accordance with current European guidelines and local institutional protocols, prioritizing the safest and most effective option for the individual patient. This iterative process ensures that patient safety and optimal diagnostic and therapeutic outcomes are achieved. Question 6. Regulatory review indicates a patient presence with severe abdominal pain, elevated lactate, and signs of hypoperfusion. Initial CT angiography shows no definitive evidence of arterial occlusion in the mesenteric vasculature, but the clinical suspicion for acute mesenteric ischemia remains high. What is the most appropriate next step in managing this patient according to European Board of Interventional Radiology (EBIR) guidelines and best practices? Option A. Perform a diagnostic ultrasound of the abdomen to assess for bowel wall edema and free fluid. Option B. Proceed with an immediate exploratory laparotomy given the high clinical suspicion and potential for rapid deterioration. Option C. Discuss the case with the referring clinician and a senior interventional radiologist to review all clinical and imaging data, consider further imaging modalities if indicated, and collaboratively decide on the optimal diagnostic or therapeutic pathway. Option D. Initiate empirical anticoagulation therapy and monitor the patient's clinical response closely. The correct answer is C. Discuss the case with the referring clinician and a senior interventional radiologist to review all clinical and imaging data, consider further imaging modalities if indicated, and collaboratively decide on the optimal diagnostic or therapeutic pathway. Explanation. Scenario analysis. This scenario presents a common challenge in interventional radiology, where a patient's clinical presentation and imaging findings appear to contradict established diagnostic pathways. The interventional radiologist must balance the urgency of a potentially life-threatening condition with the need for accurate diagnosis and appropriate treatment, all while adhering to established European guidelines and best practices for patient care. The challenge lies in interpreting complex imaging, considering differential diagnoses, and deciding on the most appropriate next step without compromising patient safety or delaying definitive management. Correct approach analysis. The correct approach involves a systematic, evidence-based evaluation. Recognizing the discrepancy between the clinical suspicion of acute mesenteric ischemia and the initial CT findings necessitates further investigation. Consulting with the referring clinician to gather more detailed clinical information and discussing the case with a senior colleague or multidisciplinary team, e.g., vascular surgeon, gastroenterologist, are crucial steps. This collaborative approach ensures all available information is considered, differential diagnoses are thoroughly explored, and the most appropriate diagnostic or therapeutic intervention is chosen in line with European Board of Interventional Radiology (EBIR) principles of patient-centered care and evidence-based practice. This aligns with the EBIR emphasis on continuous learning, critical appraisal of evidence, and collaborative decision-making in complex cases. Incorrect approaches analysis. Pursuing an immediate, aggressive interventional procedure without further diagnostic clarification would be a significant regulatory and ethical failure. This bypasses the fundamental principle of accurate diagnosis before intervention, potentially leading to unnecessary procedures, patient harm, and resource misallocation. It contravenes the EBIR commitment to evidence-based medicine and patient safety, which mandates a thorough diagnostic workup. Proceeding with conservative management solely based on the initial negative CT, despite strong clinical suspicion, also represents a failure. This neglects the potential for subtle findings or alternative diagnoses that may not be immediately apparent on initial imaging. It risks delaying critical treatment for a potentially emergent condition, violating the ethical duty to act in the patient's best interest, and potentially contravening guidelines on managing suspected acute mesenteric ischemia. Performing a different, unrelated interventional procedure without a clear diagnostic rationale would be a gross violation of professional standards and patient safety. This demonstrates a lack of clinical judgment and adherence to established protocols, leading to inappropriate patient care and potential harm. Professional reasoning. Professionals facing such a dilemma should employ a structured decision-making process. This involves 1. Thoroughly reviewing all available clinical data and imaging. 2. Identifying discrepancies and potential causes. 3. Formulating a differential diagnosis. 4. Consulting with relevant specialists and senior colleagues. 5. Considering the risks and benefits of further diagnostic or therapeutic interventions. 6. Documenting the decision-making process and rationale. This systematic approach, grounded in EBIR principles, ensures patient safety and adherence to regulatory and ethical standards. Question 7. System analysis indicates that understanding the historical trajectory of interventional radiology is fundamental to its current practice and future development. Considering the European context relevant to the European Board of Interventional Radiology, EBIR, examination, which of the following represents the most significant historical development in the establishment of interventional radiology as a distinct medical specialty in Europe? Option A. The widespread adoption of endovascular techniques for peripheral arterial disease treatment, leading to a significant reduction in open surgical procedures. Option B. The invention of the Seldinger technique, which revolutionized vascular access and laid the groundwork for minimally invasive procedures. Option C. The development of advanced imaging modalities such as CT angiography and MRI, which enhanced diagnostic capabilities for vascular pathologies. Option D. The establishment of dedicated interventional radiology training pathways and the formation of European professional societies advocating for specialty recognition. The correct answer is A. The widespread adoption of endovascular techniques for peripheral arterial disease treatment, leading to a significant reduction in open surgical procedures. Explanation. The scenario presents a challenge in understanding the historical evolution of interventional radiology, within the European context, specifically as it pertains to the EBIR examination. The difficulty lies in discerning which historical milestones are most significant from a European regulatory and educational perspective, rather than a purely global or anecdotal one. A deep understanding of the foundational principles and key figures that shaped IR in Europe is crucial for demonstrating competence in the EBIR exam. The correct approach involves identifying the development of IR as a distinct specialty, moving beyond its origins as a subdiscipline of diagnostic radiology. This includes recognizing the establishment of dedicated training programs, the formation of European professional societies, and the standardization of techniques and ethical guidelines that have been instrumental in its growth and recognition. This aligns with the EBIR mandate to assess a comprehensive understanding of the field, including its historical trajectory and the factors that have led to its current standing. An incorrect approach would be to focus solely on individual technological advancements without considering their integration into a structured specialty. For instance, highlighting the invention of a specific catheter without acknowledging the subsequent development of standardized training and accreditation for its use would be a superficial understanding. Another incorrect approach would be to emphasize the contributions of non-European pioneers without recognizing the parallel and distinct developments within Europe that have shaped its unique IR landscape. This fails to address the specific jurisdictional focus of the EBIR exam, which is rooted in European medical practice and education. Furthermore, prioritizing anecdotal accounts, or the commercial development of devices over the establishment of formal scientific bodies and educational frameworks, would demonstrate a lack of understanding of the professionalization of IR in Europe. The professional reasoning process should involve critically evaluating historical narratives through the lens of specialty development, formal education, and European professional consensus. Professionals preparing for the EBIR should seek out resources that detail the evolution of IR as a recognized medical discipline within Europe, focusing on the establishment of its educational pathways, professional organizations, and regulatory frameworks that have contributed to its current status. Question 8. Operational review demonstrates the availability of a novel MRI contrast agent with purported enhanced diagnostic capabilities. What is the most appropriate approach for an interventional radiology department to assess and integrate this new agent into its practice, ensuring compliance with European regulatory frameworks and best practices? Option A. Immediately adopt the new contrast agent based on the manufacturer's promotional materials and claims of superior performance. Option B. Introduce the new contrast agent without updating existing departmental protocols or providing specific training to staff on its use and potential complications. Option C. Conduct a comprehensive impact assessment, including a review of peer-reviewed literature on efficacy and safety, comparison with existing agents, evaluation of contraindications and adverse events, assessment of training needs, and alignment with European guidelines on contrast media. Option D. Implement the new contrast agent based on informal recommendations from other interventional radiologists without a formal review of its scientific evidence. The correct answer is C. Conduct a comprehensive impact assessment, including a review of peer-reviewed literature on efficacy and safety, comparison with existing agents, evaluation of contraindications and adverse events, assessment of training needs, and alignment with European guidelines on contrast media. Explanation. Scenario analysis. This scenario presents a professional challenge in balancing patient safety, diagnostic efficacy, and resource management within the specific regulatory framework of the European Board of Interventional Radiology, EBIR. The introduction of a new MRI contrast agent necessitates a thorough impact assessment to ensure its safe and effective integration into clinical practice, adhering to all relevant European guidelines and directives concerning medical devices and pharmaceuticals. The challenge lies in systematically evaluating the agent's performance, safety profile, and logistical implications without compromising patient care or exceeding regulatory compliance. Correct approach analysis. The correct approach involves a multifaceted impact assessment that systematically evaluates the new MRI contrast agent across several critical domains. This includes a review of its established efficacy and safety data, comparison with existing agents, assessment of potential contraindications and adverse reactions, and an evaluation of the necessary training and procedural adjustments for interventional radiologists and support staff. Furthermore, it requires an analysis of the economic implications and the alignment with current European guidelines on the use of contrast media in medical imaging. This comprehensive approach ensures that the introduction of the new agent is evidence-based, patient-centered, and compliant with EBIR emphasis on quality and safety in interventional radiology. Adherence to guidelines such as those from the European Society of Radiology (ESR) and relevant EU directives on medical devices and pharmaceuticals is paramount. Incorrect approach is analysis. Implementing the new contrast agent solely based on manufacturer claims without independent verification or a structured impact assessment represents a significant regulatory and ethical failure. This approach bypasses the due diligence required to ensure patient safety and diagnostic accuracy, potentially exposing patients to unknown risks or suboptimal imaging. It neglects the professional responsibility to critically evaluate new technologies and their integration into practice, which is a cornerstone of EBIR standards. Adopting the new agent based on anecdotal evidence from colleagues without a formal review of its scientific literature and safety profile is another regulatory and ethical lapse. This relies on hearsay rather than evidence-based practice, which is contrary to the principles of good medical practice and the rigorous standards expected by EBIR. It fails to account for potential differences in patient populations, equipment, or procedural protocols that might influence the agent's performance and safety. Introducing the contrast agent without updating departmental protocols or providing adequate staff training on its specific administration, potential side effects, and management of adverse events is a critical failure. This directly compromises patient safety and the quality of care, as staff may not be equipped to handle the nuances of the new agent. It violates the principle of ensuring competent practice, a fundamental requirement for all healthcare professionals operating under EBIR purview. Professional reasoning. Professionals should adopt a structured, evidence-based approach to evaluating new medical technologies. This involves 1. Initiating a literature search for peer-reviewed studies on the agent's efficacy and safety. 2. Consulting relevant professional guidelines and regulatory bodies, e.g., European Medicines Agency recommendations, ESR guidelines. 3. Conducting a risk-benefit analysis for specific patient populations. 4. Developing clear protocols for administration and adverse event management. And 5. Ensuring comprehensive staff training and competency assessment. This systematic process ensures that decisions are informed, patient safety is prioritized, and regulatory compliance is maintained, aligning with the high standards of the EBIR. Question 9. Implementation of fluoroscopic techniques in interventional radiology procedures requires a careful balance between achieving adequate image quality for diagnosis and treatment and minimizing radiation exposure. Considering the principles of radiation protection as outlined by European regulations and professional guidelines, which of the following approaches best reflects best practice for radiation dose optimization during fluoroscopy? Option A. Prioritizing the use of pulsed fluoroscopy and selecting the lowest frame rate that provides adequate visualization for the specific procedural step. Option B. Consistently using continuous fluoroscopy for all procedures to ensure the highest possible image clarity. Option C. Neglecting to use collimation to avoid any potential obstruction of the field of view. Option D. Employing the highest available frame rate for all fluoroscopic imaging to capture maximum detail. The correct answer is A. Prioritizing the use of pulsed fluoroscopy and selecting the lowest frame rate that provides adequate visualization for the specific procedural step. Explanation. Scenario analysis. This scenario presents a common challenge in interventional radiology, balancing the need for adequate fluoroscopic visualization to ensure patient safety and procedural success with the imperative to minimize radiation exposure to both the patient and the interventional team. The inherent risks associated with ionizing radiation, including stochastic effects like cancer induction and deterministic effects at higher doses, necessitate a rigorous approach to radiation protection. The professional challenge lies in making real-time decisions that optimize image quality for diagnostic and therapeutic purposes while adhering to the EBIR, as low as reasonably achievable principle, as mandated by European directives and professional guidelines. This requires a deep understanding of fluoroscopic equipment capabilities, patient anatomy, procedural complexity, and the potential impact of radiation on all involved. Correct approach analysis. The correct approach prioritizes the use of pulsed fluoroscopy whenever feasible. Pulsed fluoroscopy delivers radiation in short bursts rather than a continuous beam, significantly reducing the overall radiation dose delivered to the patient and staff without compromising essential image quality for most interventional procedures. This aligns directly with the principles of radiation protection enshrined in European Union directives concerning the basic safety standards for protection against dangers arising from ionizing radiation, e.g. Council Directive 2013/59/EURATOM. Furthermore, it reflects best practice recommendations from professional bodies like the European Society of Radiology and the European Board of Interventional Radiology, which advocate for dose reduction techniques. By selecting the lowest frame rate that provides adequate visualization for the specific procedure, the interventional radiologist ensures that the EBIR principle is actively applied, demonstrating a commitment to patient and staff safety. Incorrect approaches analysis. Using continuous fluoroscopy without a specific, documented justification for its necessity represents a failure to adhere to the EBIR principle. This approach unnecessarily increases radiation dose to the patient and staff, potentially leading to higher cumulative exposures and increased stochastic risks. It contravenes the spirit and letter of European radiation protection legislation, which mandates dose optimization. Employing the highest available frame rate for all procedures, regardless of diagnostic need, is another regulatory and ethical failure. While high frame rates can provide smoother motion visualization, they deliver a significantly higher radiation dose. Unless the specific procedural step absolutely demands such high temporal resolution, e.g., rapid embolization of a high-flow vessel, this practice is not justifiable under EBIR and European radiation protection guidelines. Failing to utilize collimation to restrict the X-ray beam to the area of interest is a critical error. Collimation is a fundamental radiation protection measure that significantly reduces scatter radiation, thereby lowering patient dose and improving image contrast by minimizing unwanted signals. Its omission directly violates established principles of radiation safety and is a clear breach of regulatory expectations for minimizing patient exposure. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with a thorough understanding of the procedure and the patient's specific needs. Before initiating fluoroscopy, they should consider the optimal imaging parameters, including the use of pulsed modes and appropriate frame rates. Collimation should be applied as a standard practice from the outset. During the procedure, continuous assessment of image quality versus radiation dose is crucial. If a higher dose rate or frame rate is temporarily required, it should be for a clearly defined purpose and for the shortest duration necessary. Regular review of equipment settings and adherence to institutional radiation safety protocols, informed by European directives, are essential for maintaining a high standard of care and minimizing radiation risks. Question 10. Benchmark analysis indicates that an interventional radiologist has a significant personal financial investment in a company that has developed a novel angioplasty balloon. While preliminary manufacturer data suggests improved luminal gain compared to current devices, independent, peer-reviewed clinical trials are still pending. The radiologist is considering recommending this new balloon to patients undergoing complex peripheral artery interventions, believing it may offer a superior outcome. What is the most ethically sound course of action according to European Board of Interventional Radiology, EBIR, guidelines? Option A. Recommend the new device to patients, emphasizing its potential for improved outcomes, and defer disclosure of the financial interest until after the procedure. To avoid influencing the patient's decision, Option B. Fully disclose the financial interest to the patient and the Institutional Ethics Committee, and only proceed with the new device if independent evidence supports its superiority or non-inferiority to existing treatments, and after obtaining comprehensive informed consent. Option C. Proceed with using the new device, citing the promising preliminary manufacturer data, and inform the patient that it is a newer technology that may offer better results. Option D. Utilize the new device for all eligible patients, as the potential for improved outcomes and the financial benefit to the radiologist represent a justifiable advancement in patient care. Correct answer is B. Fully disclose the financial interest to the patient and the Institutional Ethics Committee, and only proceed with the new device if independent evidence supports its superiority or non-inferiority to existing treatments, and after obtaining comprehensive informed consent. Explanation. Scenario analysis. This scenario presents a significant ethical challenge stemming from a potential conflict of interest and the principle of patient autonomy. The interventional radiologist has a financial stake in a new device that could offer a perceived benefit to patients, but this benefit is not yet definitively established through rigorous, independent clinical trials. The core difficulty lies in balancing the potential for innovation and personal gain with the paramount duty to act solely in the patient's best interest. Ensuring informed consent is truly informed and free from undue influence. The pressure to adopt a new technology, especially when linked to personal financial benefit, can subtly compromise objective clinical judgment. Correct approach analysis. The correct approach prioritizes patient welfare and transparency above all else. It involves a thorough, independent evaluation of the new device's efficacy and safety, seeking evidence beyond the manufacturer's claims. Crucially, it mandates full disclosure of the financial interest to the patient and the relevant ethics committee or institutional review board. This disclosure allows for an unbiased assessment of the situation and empowers the patient to make a truly informed decision, free from any perceived coercion or hidden agenda. Adherence to the European Board of Interventional Radiology, EBIR, ethical guidelines, which emphasize patient-centered care, honesty, and avoidance of conflicts of interest, is fundamental. The decision to use the device should only be made if it demonstrably offers superior outcomes or a comparable outcome with fewer risks compared to existing, well-established treatments, and only after comprehensive informed consent. Incorrect approaches analysis. One incorrect approach involves proceeding with the use of the new device without full disclosure of the financial interest. This is a direct violation of ethical principles of honesty and transparency, and it undermines the patient's right to informed consent. It creates a situation where the patient cannot make a truly autonomous decision, as they are unaware of a significant factor that could influence the physician's recommendation. This failure to disclose is a breach of trust and potentially contravenes EBIR guidelines on professional conduct and conflicts of interest. Another incorrect approach is to rely solely on the manufacturer's data and promotional materials to justify the use of the device. This approach neglects the critical need for independent verification of efficacy and safety. Ethical practice demands a critical appraisal of all evidence, especially when a financial incentive is present. Over-reliance on biased information compromises objective decision-making and can lead to the adoption of unproven or even harmful technologies, failing the duty of care to the patient. A third incorrect approach is to prioritize the potential for personal financial gain over the established standard of care, even if the new device offers only marginal or unproven benefits. This represents a clear conflict of interest, where personal interests are placed above the patient's well-being. EBIR ethical principles strictly prohibit such prioritization, emphasizing that the patient's best interest is the sole determinant of treatment decisions. Professional reasoning. Professionals facing such dilemmas should employ a structured decision-making framework. First, identify and acknowledge any potential conflicts of interest. Second, seek objective, independent evidence regarding the new technology's efficacy and safety, critically evaluating all data sources. Third, consult with peers and ethics committees to gain diverse perspectives and ensure adherence to professional standards. Fourth, if a decision is made to consider the new technology, ensure complete and transparent disclosure of all relevant information, including financial interests to the patient. Fifth, obtain truly informed consent, ensuring the patient understands all risks, benefits, and alternatives, and feels empowered to make their own choice. Finally, document the entire decision-making process thoroughly. Question 11. Stakeholder feedback indicates a concern that some interventional radiologists may be over-relying on perceived image brightness to judge fluoroscopy adequacy, potentially leading to suboptimal radiation dose management. Considering the principles of fluoroscopy and European regulatory expectations for radiation protection, which of the following approaches best addresses this concern and ensures adherence to the EBIR principle? Option A. Neglecting the use of beam collimation, allowing the fluoroscopic field to encompass a wider area than strictly necessary for the procedure. Option B. Systematically adjusting fluoroscopy parameters such as pulse rate, collimation, and filtration based on anatomical region, patient size, and procedural phase, while actively monitoring dose rates and verifying diagnostic image quality. Option C. Maintaining a constant, high pulse rate and frame rate throughout all procedures to ensure consistently smooth image acquisition, regardless of the specific clinical requirements. Option D. Relying solely on the automatic brightness control, ABC feature of the fluoroscopy unit to achieve acceptable image brightness, without actively assessing other dose-influencing parameters. Correct answer is B. Systematically adjusting fluoroscopy parameters such as pulse rate, collimation, and filtration based on anatomical region, patient size, and procedural phase, while actively monitoring dose rates and verifying diagnostic image quality. Explanation. Scenario analysis. This scenario presents a common challenge in interventional radiology, balancing the need for adequate fluoroscopic visualization to ensure patient safety and procedural success with the imperative to minimize radiation exposure to both the patient and the staff. The feedback highlights a potential discrepancy between perceived image quality and actual radiation dose, requiring a nuanced understanding of fluoroscopy principles and their practical application within the EBIR framework. The professional challenge lies in making informed decisions about image acquisition parameters that optimize diagnostic information while adhering to radiation protection principles, as mandated by European directives and professional guidelines. Correct approach analysis. The correct approach involves a systematic evaluation of fluoroscopy parameters, prioritizing dose reduction techniques without compromising diagnostic image quality. This aligns with the EBIR, as low as reasonably achievable principle, a cornerstone of radiation protection in Europe, and is further elaborated in guidelines relevant to interventional radiology. Specifically, it requires understanding how factors like pulse rate, collimation, filtration, and image processing affect both image quality and dose. Adjusting these parameters based on the specific anatomical region, patient size, and procedural phase, and verifying the impact on dose rates through real-time monitoring represents best professional practice. This approach is ethically sound, as it prioritizes patient well-being and adheres to regulatory requirements for radiation safety. Incorrect approach is analysis. One incorrect approach would be to solely rely on subjective visual assessment of image brightness to determine acceptable fluoroscopy settings. This fails to acknowledge that image brightness can be artificially manipulated by the system's automatic brightness control, ABC, without necessarily reflecting true image quality or dose. This can lead to unnecessarily high radiation doses if the system is compensating for suboptimal settings or patient attenuation. This approach is ethically problematic as it disregards the principle of dose optimization and potentially violates regulatory limits on radiation exposure. Another incorrect approach would be to maintain a constant, high pulse rate and frame rate for all procedures, regardless of the clinical need. While this may provide a subjectively smooth image, it significantly increases the radiation dose without a commensurate benefit in diagnostic information for many interventional procedures. This demonstrates a lack of understanding of how pulse rate directly impacts patient and staff dose, and is a failure to apply dose reduction strategies as expected under European radiation protection legislation. A third incorrect approach would be to neglect the use of beam collimation, allowing the fluoroscopic field to extend beyond the area of clinical interest. This unnecessarily irradiates healthy tissues, increasing the patient's overall radiation dose and potentially contributing to stochastic effects. Effective collimation is a fundamental dose reduction technique explicitly mentioned in radiation protection guidelines, and its omission represents a significant regulatory and ethical failure. Professional reasoning. Professionals should adopt a decision-making process that integrates theoretical knowledge of fluoroscopy principles with practical application and regulatory compliance. This involves 1. Understanding the interplay between imaging parameters, KVP, MA, pulse rate, frame rate, filtration, collimation, and their impact on image quality and radiation dose. 2. Utilizing the fluoroscopy unit's dose monitoring features to inform adjustments. 3. Applying the EBIR principle proactively throughout the procedure. 4. Staying abreast of current European guidelines and regulatory requirements for radiation protection in interventional radiology. And 5. Engaging in continuous professional development to refine these skills. Question 12. Quality control measures reveal a consistent trend of slightly increased patient radiation doses during a specific interventional radiology procedure, without a corresponding significant improvement in diagnostic image quality. According to the European Board of Interventional Radiology, EBIR, framework and relevant EU directives on medical exposure to ionizing radiation, which of the following actions is the most appropriate initial response? Option A. Immediately increase the exposure factors on the imaging equipment to compensate for any perceived minor image noise, ensuring diagnostic clarity is maintained. Option B. Document the dose increase but defer any corrective actions until a more significant deviation from diagnostic reference levels is observed. Option C. Conduct a thorough review of the imaging protocol for that specific procedure to identify potential areas for optimization, alongside a comprehensive performance evaluation of the imaging equipment used. Option D. Focus on staff training regarding radiation safety principles, without investigating the specific procedural or equipment factors contributing to the dose increase. The correct answer is C. Conduct a thorough review of the imaging protocol for that specific procedure to identify potential areas for optimization, alongside a comprehensive performance evaluation of the imaging equipment used. Explanation. This scenario presents a professional challenge because it requires balancing the immediate clinical need for diagnostic imaging with the long-term imperative of radiation protection, as mandated by European Union directives and national implementations thereof, such as those governing medical exposure to ionizing radiation. The core of the challenge lies in ensuring that patient doses are as low as reasonably achievable EBIR, without compromising diagnostic image quality or delaying necessary procedures. This requires a nuanced understanding of regulatory requirements, equipment performance, and clinical protocols. The correct approach represents best professional practice because it directly addresses the identified issue through a systematic, evidence-based, and regulatory-aligned process. By initiating a review of equipment performance and protocol optimization, it adheres to the principles of radiation protection enshrined in EU legislation, which mandates regular quality assurance and optimization of medical exposures. This proactive stance ensures that the equipment is functioning optimally and that the protocols are designed to deliver the required diagnostic information at the lowest possible dose. This aligns with the fundamental ethical duty of care to the patient and the legal obligation to comply with radiation protection regulations. An incorrect approach that focuses solely on increasing exposure factors to compensate for perceived image degradation, without investigating the root cause, represents a significant regulatory and ethical failure. This would likely lead to unnecessary increases in patient dose, violating the EBIR principle, and potentially exceeding diagnostic reference levels without justification. It also fails to address potential equipment malfunction or protocol deficiencies thereby not fulfilling the quality assurance requirements mandated by regulatory frameworks. Another incorrect approach, such as disregarding the findings due to perceived low individual dose increases, is also professionally unacceptable. Regulatory compliance is not based on the magnitude of individual deviations, but on the establishment and maintenance of robust quality control systems. Ignoring such findings undermines the entire radiation protection framework and could lead to cumulative dose increases across a patient population or over time, which is contrary to the precautionary principle inherent in radiation safety. Furthermore, an approach that involves immediate, unverified adjustments to equipment settings without a structured review process is problematic. While responsiveness is important, it must be guided by a systematic approach that includes investigation, validation, and documentation, as expected under quality management systems for medical imaging. The professional reasoning process for similar situations should involve 1. Acknowledging and documenting the quality control finding. 2. Initiating a systematic investigation into the potential causes, including equipment performance checks and protocol review. 3. Consulting relevant technical and clinical experts. 4. Implementing evidence-based corrective actions, which may include equipment calibration, protocol optimization, or staff training. 5. Verifying the effectiveness of the corrective actions through repeat quality control measures. 6. Documenting all steps and outcomes for regulatory compliance and continuous improvement. Question 13. Investigation of a 65-year-old male patient with a symptomatic arteriovenous malformation, AVM, in the superficial thigh, presenting with pain and swelling. The interventional radiologist plans to perform ultrasound-guided embolization of the feeding artery. Considering the EBIR framework, which of the following approaches best ensures patient safety and procedural success? Option A. Performing the procedure using only anatomical landmarks without any ultrasound guidance, as the feeding artery is palpable. Option B. Employing a high-frequency linear transducer with color and power Doppler, ensuring continuous real-time needle guidance with a sterile probe cover. Option C. Using a high-frequency linear transducer, but without a sterile probe cover to maintain tactile feedback. Option D. Utilizing a low-frequency curvilinear transducer to visualize deeper structures, with intermittent ultrasound checks during needle insertion. The correct answer is B. Employing a high-frequency linear transducer with color and power Doppler, ensuring continuous real-time needle guidance with a sterile probe cover. Explanation. This scenario presents a common challenge in interventional radiology, managing a patient with a complex vascular anomaly requiring ultrasound-guided intervention, where the optimal approach is debated due to potential risks and the need for precise guidance. The professional challenge lies in balancing the patient's need for treatment with the inherent risks of intervention in a delicate anatomical region, requiring a thorough understanding of ultrasound physics, anatomical variations, and adherence to European Board of Interventional Radiology, EBIR, guidelines for patient safety and procedural efficacy. The correct approach represents best professional practice because it prioritizes patient safety and procedural success through meticulous planning and execution. Utilizing high-frequency transducers for optimal resolution of superficial vascular structures, employing color and power Doppler to delineate flow dynamics and identify the target vessel precisely, and performing real-time needle guidance with a sterile probe cover are all fundamental EBIR principles for safe and effective ultrasound-guided interventions. This approach minimizes the risk of inadvertent injury to adjacent structures and ensures accurate needle placement, which is paramount for successful treatment and patient outcomes, aligning with the EBIR emphasis on evidence-based practice and patient-centered care. An incorrect approach involving the use of a lower-frequency transducer would compromise image resolution, making precise identification of the target vessel and surrounding anatomy more difficult, thereby increasing the risk of complications. This failure to optimize imaging parameters directly contravenes EBIR recommendations for achieving diagnostic quality images necessary for interventional procedures. Another incorrect approach, performing the intervention without continuous real-time ultrasound guidance, would be a severe ethical and regulatory breach. This would essentially revert the procedure to a blind technique, significantly elevating the risk of misplacement, vascular injury, or damage to vital organs, which is explicitly prohibited by EBIR standards for ultrasound-guided interventions. Finally, Attempting the intervention without adequate sterile precautions for the ultrasound probe would introduce a significant risk of infection, a direct violation of infection control protocols mandated by EBIR and general medical ethics. Professional decision-making in such situations requires a systematic approach. First, a comprehensive assessment of the patient's anatomy and pathology using diagnostic imaging. Second, careful consideration of the available ultrasound technology and its limitations. Third, selection of the most appropriate transducer and imaging modalities, e.g., Doppler for the specific intervention. Fourth, meticulous planning of the needle trajectory and entry point. And fifth, continuous, real-time ultrasound monitoring throughout the entire procedure, coupled with strict adherence to sterile techniques. This structured approach ensures that all potential risks are mitigated and that the intervention is performed with the highest degree of safety and precision, in accordance with EBIR standards. Question 14. What factors determine the appropriate selection of diagnostic imaging modalities and subsequent interventional strategies for patients presenting with common vascular pathologies, ensuring compliance with European Board of Interventional Radiology (EBIR) standards and relevant EU regulatory frameworks? Option A. The preference of referring physicians for particular imaging modalities or interventional techniques, even if they are not the most appropriate for the diagnosed pathology or are not supported by current European guidelines. Option B. The patient's clinical presentation, the specific vascular pathology identified, the availability of advanced imaging techniques, and adherence to established European Society of Radiology (ESR) guidelines for vascular interventions. Option C. The cost-effectiveness of different imaging modalities and the potential for immediate procedural revenue, without primary consideration of patient-specific factors or regulatory compliance. Option D. The interventional radiologist's personal experience with specific procedures and the perceived urgency of the patient's condition, irrespective of detailed diagnostic confirmation or established guidelines. The correct answer is B. The patient's clinical presentation, the specific vascular pathology identified, the availability of advanced imaging techniques, and adherence to established European Society of Radiology (ESR) guidelines for vascular interventions. Explanation: the scenario of managing a patient with a common vascular pathology, such as deep vein thrombosis, DVT, or peripheral artery disease, PAD, presents a professional challenge due to the potential for significant morbidity and mortality if mismanaged. Interventional radiologists must navigate complex clinical presentations, diagnostic uncertainties, and a range of treatment options, all while adhering to strict regulatory frameworks governing patient care and medical practice within the European Union, as mandated by the European Board of Interventional Radiology (EBIR). The decision-making process is further complicated by the need to balance immediate patient needs with long-term outcomes and resource utilization, all within the scope of their specialized expertise. The correct approach emphasizes a comprehensive, evidence-based, and patient-centered strategy. This involves a thorough clinical assessment, appropriate diagnostic imaging, e.g., ultrasound, CT angiography, MR angiography, and a multidisciplinary discussion to determine the optimal management plan. This plan should be tailored to the individual patient's condition, comorbidities, and preferences, and should align with current European Society of Radiology (ESR) guidelines and relevant national regulations concerning interventional procedures. Adherence to these guidelines ensures that interventions are performed only when indicated, with appropriate consent, and by qualified practitioners, thereby upholding the highest standards of patient safety and efficacy. The focus on shared decision-making and informed consent is paramount, reflecting the ethical obligations of healthcare professionals. An incorrect approach might involve proceeding with an intervention based solely on a preliminary or incomplete diagnostic workup, without considering alternative or conservative management strategies. This could lead to unnecessary procedures, potential complications, and suboptimal patient outcomes. Such an approach would violate regulatory requirements for appropriate indication and evidence-based practice, potentially contravening guidelines from bodies like the European Society of Vascular Surgery (ESVS), or national regulatory authorities that govern the performance of interventional procedures. Another incorrect approach could be to overlook or inadequately address patient comorbidities, such as renal insufficiency or bleeding diathesis, which are critical factors in determining the safety and feasibility of interventional techniques. This failure to consider the holistic patient profile represents a breach of professional duty and regulatory expectations for comprehensive patient assessment. Furthermore, failing to obtain adequate informed consent, which includes discussing risks, benefits, and alternatives, is a significant ethical and regulatory violation, undermining patient autonomy. Professional decision-making in these situations requires a systematic approach. This involves first confirming the diagnosis with appropriate imaging, then assessing the severity and extent of the pathology. Subsequently, all available treatment options, including conservative management, medical therapy, and various interventional techniques, should be considered. A critical step is to evaluate the patient's overall health status and comorbidities to determine the safest and most effective course of action. Finally, a thorough discussion with the patient, involving shared decision-making and obtaining informed consent, is essential before proceeding with any intervention. This structured process ensures that decisions are not only clinically sound, but also ethically and regulatorily compliant. Question 15. When evaluating a patient with a known history of cognitive impairment who is requesting a complex interventional radiology procedure with significant potential risks, but who appears lucid and articulate during the initial consultation, what is the most ethically and regulatorily sound approach to obtaining consent? Option A. Immediately involve the patient's next of kin and make the decision collaboratively with them, overriding the patient's request if their assessment differs from the patient's expressed wishes. Option B. Conduct a formal assessment of the patient's capacity to consent, seek a second opinion on capacity if doubt persists, and involve the patient's designated legal representative or next of kin in the decision-making process, while still actively seeking the patient's input and assent. Option C. Proceed with the procedure as requested, assuming the patient's current lucidity indicates full capacity to consent, given their articulate communication during the consultation. Option D. Inform the patient of the risks and benefits and obtain their signature on the consent form, then proceed with the procedure without further consultation, as their request is the primary driver. The correct answer is B. Conduct a formal assessment of the patient's capacity to consent, seek a second opinion on capacity if doubt persists, and involve the patient's designated legal representative or next of kin in the decision-making process, while still actively seeking the patient's input and assent. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the clinician's assessment of potential benefit and risk, particularly when the patient's capacity to consent is in question. The EBIR framework, aligned with European medical ethics and professional guidelines, emphasizes patient autonomy while also mandating the clinician's responsibility to act in the patient's best interest, especially when capacity is compromised. Careful judgment is required to navigate these competing principles. The correct approach, which involves a thorough assessment of the patient's capacity to consent, seeking a second opinion on this capacity if doubt exists, and involving the patient's legal representative or next of kin in the decision-making process, while still respecting the patient's expressed wishes as much as possible, represents best professional practice. This aligns with the principles of informed consent, beneficence, and non-maleficence, as enshrined in European medical law and ethical codes. It upholds the patient's right to self-determination to the extent of their capacity, while ensuring that decisions are made with appropriate oversight and consideration for their overall well-being. An incorrect approach would be to proceed with the intervention solely based on the patient's initial request without a comprehensive capacity assessment, especially given the known risks and the patient's underlying condition. This would violate the principle of informed consent, as the patient may not fully comprehend the implications of the procedure. Proceeding without involving a legal representative or next of kin when capacity is questionable also fails to uphold the patient's rights and could lead to legal and ethical repercussions. Another incorrect approach would be to unilaterally override the patient's wishes based on the clinician's personal judgment of benefit without a formal capacity assessment or consultation with relevant parties. This disregards patient autonomy and could be seen as paternalistic, potentially leading to a breakdown of trust and legal challenges. Professionals should employ a structured decision-making process that begins with a clear understanding of the patient's condition and the proposed intervention. This should be followed by a rigorous assessment of the patient's capacity to consent, utilizing established criteria. If capacity is uncertain, seeking a second opinion from a qualified professional is crucial. Involving the patient's legal representative or next of kin is essential when capacity is compromised, ensuring that decisions are made in the patient's best interest and in accordance with their known values and preferences. Throughout this process, open communication and shared decision-making, to the extent of the patient's capacity, should be prioritized. Question 16. Risk assessment procedures indicate that a patient presents with a complex vascular anomaly in the upper limb, suspected to be a high-flow arteriovenous malformation, AVM, requiring embolization. The interventional radiologist must select the most appropriate imaging technique for pre-procedural assessment and intra-procedural guidance. Which of the following approaches best aligns with European Board of Interventional Radiology, EBIR, guidelines for optimizing imaging in this scenario? Option A. Employ computed tomography angiography, CTA, for pre-procedural assessment to delineate the extent of the AVM, and then proceed to embolization using only fluoroscopy without contrast. Option B. Select magnetic resonance angiography, MRA, for pre-procedural assessment due to its excellent soft tissue contrast, and then perform the embolization using only plain radiography. Option C. Rely solely on ultrasound with Doppler for pre-procedural assessment, as it is non-invasive and readily available, and then proceed directly to embolization without further detailed vascular imaging. Option D. Utilize digital subtraction angiography, DSA, for both pre-procedural assessment and intra-procedural guidance, as it provides high-resolution, dynamic imaging of the vascular anatomy and flow dynamics essential for precise embolization. Correct answer is D. Utilize digital subtraction angiography, DSA, for both pre-procedural assessment and intra-procedural guidance, as it provides high-resolution, dynamic imaging of the vascular anatomy and flow dynamics essential for precise embolization. Explanation. Scenario analysis. This scenario presents a common challenge in interventional radiology where the optimal imaging technique for a specific procedure must be selected, balancing diagnostic accuracy, patient safety, and resource utilization. The professional challenge lies in interpreting the nuances of different imaging modalities and their applicability to a complex clinical presentation, ensuring adherence to European guidelines and best practices for patient care. Correct approach analysis. The correct approach prioritizes a comprehensive understanding of the patient's condition and the capabilities of various imaging techniques, selecting a modality that provides the most detailed anatomical and functional information relevant to the suspected pathology, while minimizing radiation exposure and contrast agent risks, represents best professional practice. This aligns with the European Board of Interventional Radiology, EBIR, principles of patient-centered care and evidence-based practice, emphasizing the selection of the most appropriate imaging for diagnosis and intervention planning. Adherence to established European guidelines for imaging in interventional radiology is paramount. Incorrect approaches analysis. An approach that solely relies on the most readily available or familiar imaging technique, without considering its suitability for the specific clinical question, is professionally unacceptable. This could lead to suboptimal diagnosis, delayed or incorrect intervention, and potentially increased patient risk. It fails to meet the EBIR standard of employing the most effective imaging modality, choosing an imaging technique that involves significantly higher radiation dose or contrast agent load than necessary for the diagnostic task, without clear clinical justification, is also a failure. This contravenes the ALARA, as low as reasonably achievable principle, a cornerstone of radiation protection in medical imaging, and the EBIR emphasis on patient safety. Opting for an imaging technique that provides insufficient detail to confidently guide the interventional procedure would be a critical error. This demonstrates a lack of due diligence in assessing the diagnostic requirements of the intervention and could lead to procedural complications or failure, violating the EBIR standard for competence and patient safety. Professional reasoning. Professionals should adopt a systematic decision-making process. This involves 1. Thoroughly reviewing the patient's clinical history, physical examination, and laboratory findings to define the diagnostic and interventional question. 2. Evaluating the strengths and limitations of available imaging modalities in the context of the specific clinical scenario and the suspected pathology. 3. Consulting relevant European guidelines and literature for best practices in imaging for interventional radiology. 4. Considering patient-specific factors such as comorbidities, allergies, and pregnancy status. 5. Selecting the imaging technique that offers the optimal balance of diagnostic yield, safety, and efficiency, always adhering to the ALARA principle. Question 17. Cost-benefit analysis shows that Doppler ultrasound is highly effective for initial assessment of peripheral arterial disease and venous insufficiency, offering a non-invasive and cost-efficient diagnostic tool. However, in a patient presenting with intermittent claudication and equivocal duplex ultrasound findings suggestive of femoropopliteal stenosis, what is the most appropriate next step in diagnostic management according to European best practices for interventional radiology? Option A. Schedule the patient for conventional angiography for definitive diagnosis and potential intervention. Option B. Initiate anticoagulation therapy based on the suggestive Doppler findings. Option C. Proceed with CT angiography to precisely delineate the extent and severity of the stenosis. Option D. Recommend a trial of conservative management and repeat Doppler ultrasound in 3 months. Correct answer is C. Proceed with CT angiography to precisely delineate the extent and severity of the stenosis. Explanation. Scenario analysis. This scenario presents a common challenge in interventional radiology, where the optimal diagnostic tool for a specific clinical question needs to be selected, balancing diagnostic accuracy, patient safety, resource utilization, and adherence to established clinical guidelines. The challenge lies in discerning when Doppler ultrasound, despite its advantages, might be insufficient or superseded by other modalities for definitive diagnosis, particularly in complex vascular pathologies. Correct approach analysis. The correct approach prioritizes a comprehensive diagnostic strategy that leverages Doppler ultrasound for initial assessment and guidance, but recognizes its limitations. It advocates for proceeding to a more definitive imaging modality, such as CT angiography or MR angiography, when Doppler findings are equivocal or insufficient to guide definitive management. This aligns with the EBIR emphasis on evidence-based practice and patient-centered care, ensuring that diagnostic decisions are robust and lead to appropriate treatment pathways. Adherence to European Society of Radiology (ESR) guidelines and National Radiology Society recommendations, which often detail the stepwise approach to vascular imaging, is implicitly expected. Incorrect approaches analysis. An approach that solely relies on Doppler ultrasound for all vascular assessments, even in the presence of equivocal findings, fails to acknowledge the inherent limitations of the modality in certain anatomical regions or for specific pathologies, e.g., deep venous thrombosis in obese patients, complex arterial aneurysms with significant artifact. This can lead to delayed or incorrect diagnoses, potentially violating the principle of providing the best possible care and adhering to established diagnostic algorithms. Another incorrect approach would be to immediately escalate to more invasive or resource-intensive imaging modalities like conventional angiography without a thorough initial assessment with Doppler ultrasound, especially when Doppler is indicated and potentially sufficient. This disregards the cost-effectiveness and non-invasiveness of ultrasound, potentially leading to unnecessary radiation exposure, contrast agent administration, and increased healthcare costs, which are all considerations within the broader European healthcare framework. An approach that dismisses Doppler ultrasound entirely for suspected vascular pathology, even for initial screening or guidance, is also flawed. Doppler ultrasound is a cornerstone of vascular imaging due to its accessibility, lack of ionizing radiation, and ability to provide functional information. Its exclusion without clinical justification would be contrary to best practice and potentially inefficient. Professional reasoning. Professionals should adopt a systematic approach to diagnostic imaging. This involves 1. Understanding the clinical question and the suspected pathology. 2. Evaluating the strengths and limitations of available imaging modalities, including Doppler ultrasound, in the context of the specific clinical scenario and anatomical location. 3. Consulting relevant clinical guidelines and best practice recommendations from professional bodies like the ESR. 4. Considering patient factors such as contraindications, comorbidities, and preference. 5. Making a reasoned decision about the most appropriate initial diagnostic step and subsequent imaging pathway, ensuring a clear plan for definitive diagnosis and management. Question 18. The efficiency study reveals that Department A utilizes advanced lead line shielding and real-time dose monitoring systems, while Department B relies on standard lead aprons and periodic dose audits. Both departments perform a comparable volume of complex interventional procedures. Considering the European Board of Interventional Radiology, EBIR, guidelines and relevant European directives on radiation protection, which of the following approaches best addresses the observed differences in equipment and safety measures to ensure optimal patient and staff safety? Option A. Prioritize the adoption of the real-time dose monitoring system from Department A and Department B, while deferring the upgrade of shielding until a later phase. Option B. Conduct a cost-benefit analysis to determine if the investment in advanced shielding and real-time monitoring is justifiable for Department B based on current procedural volumes. Option C. Implement a network-wide upgrade to the advanced shielding and real-time monitoring systems used in Department A, ensuring comprehensive staff training on their utilization. Option D. Maintain the existing protocols in both departments, as long as they are deemed compliant with minimum regulatory standards, and focus on procedural efficiency gains. The correct answer is C. Implement a network-wide upgrade to the advanced shielding and real-time monitoring systems used in Department A, ensuring comprehensive staff training on their utilization. Explanation. The efficiency study reveals a discrepancy in radiation dose reduction strategies between two interventional radiology departments within a European healthcare network, necessitating a comparative analysis of their equipment and safety measures. This scenario is professionally challenging because it requires not only an understanding of the technical aspects of radiation protection, but also the ability to critically evaluate and integrate different safety protocols and equipment choices within the overarching regulatory framework of the European Board of Interventional Radiology, EBIR. Ensuring patient and staff safety while optimizing procedural efficiency is paramount, and deviations from best practices can have significant clinical and legal ramifications. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based evaluation of all safety measures and equipment, aligning with the EBIR emphasis on continuous quality improvement and adherence to radiation protection principles as outlined in relevant European directives and guidelines. This involves a systematic review of shielding, collimation, dose monitoring, and the appropriate selection and maintenance of imaging equipment, ensuring that all practices are compliant with the ALARA as low as reasonably achievable principle. Such an approach fosters a culture of safety and promotes the adoption of the most effective radiation dose reduction techniques across the network. An incorrect approach that focuses solely on the cost-effectiveness of equipment, without a thorough assessment of its radiation safety features, fails to meet regulatory requirements. This is a significant ethical and regulatory failure, as it potentially compromises patient and staff safety for financial gain, directly contravening the principles of radiation protection mandated by European legislation. Another incorrect approach that relies on outdated safety protocols or anecdotal evidence, rather than current best practices and regulatory guidance, demonstrates a lack of professional diligence and a failure to stay abreast of advancements in radiation safety, leading to suboptimal patient care and potential noncompliance. Furthermore, an approach that neglects the importance of staff training and competency in radiation safety, despite having advanced equipment, is also a critical failure, as human factors play a crucial role in effective radiation protection. The professional decision-making process for similar situations should involve a structured approach. First, clearly define the scope of the review, focusing on specific equipment and safety measures. Second, gather all relevant data, including equipment specifications, operational protocols, incident reports, and dose monitoring data. Third, consult the latest EBIR guidelines, relevant European directives, e.g., Council Directive 2013/59/EURATOM, and national legislation pertaining to radiation protection. Fourth, conduct a comparative analysis, identifying strengths and weaknesses in each department's practices. Finally, develop and implement a unified strategy for improvement, ensuring that all recommendations are evidence-based, compliant, and promote the highest standards of patient and staff safety. Question 19. Stakeholder feedback indicates that the role of interventional radiology within the hospital's modern medicine framework is not fully appreciated, with a perception that it is primarily a diagnostic service rather than a therapeutic one. The Interventional Radiology Department has been asked to proactively demonstrate its expanded therapeutic capabilities and its contribution to improved patient outcomes and resource utilization across various clinical specialties. Which of the following strategies would best address this feedback and solidify the department's role in modern medicine, adhering to the principles of excellence and evidence-based practice promoted by the European Board of Interventional Radiology? Option A. Develop a comprehensive proposal outlining specific therapeutic interventional radiology procedures for conditions currently managed by other departments, supported by data on improved patient outcomes, reduced hospital stays, and cost-effectiveness, and present this to hospital leadership and relevant clinical heads. Option B. Request that other departments submit formal proposals for how interventional radiology can assist them, placing the onus on others to identify potential applications. Option C. Organize a series of internal grand rounds presentations that delve deeply into the technical intricacies of advanced interventional radiology techniques, without explicitly linking them to broader clinical benefits or economic advantages. Option D. Focus on increasing the volume of diagnostic imaging procedures performed by the department to demonstrate efficiency and throughput, assuming this will indirectly highlight the department's capabilities. Correct answer is A. Develop a comprehensive proposal outlining specific therapeutic interventional radiology procedures for conditions currently managed by other departments, supported by data on improved patient outcomes, reduced hospital stays and cost-effectiveness, and present this to hospital leadership and relevant clinical heads. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the established practices of a specialty with the evolving landscape of patient care and the integration of new technologies. The Interventional Radiology Department is being asked to demonstrate its value beyond traditional diagnostic imaging, which can be met with resistance or skepticism from other departments accustomed to established referral patterns and treatment pathways. The core challenge lies in proactively showcasing the unique capabilities of IR in a way that is both clinically compelling and economically justifiable within the European healthcare context, adhering to EBIR standards for quality and patient outcomes. Correct approach analysis. The correct approach involves a proactive, data-driven strategy to highlight the benefits of interventional radiology. This aligns with the EBIR emphasis on evidence-based practice and the continuous improvement of patient care. By developing a comprehensive proposal that outlines specific IR procedures for conditions currently managed by other specialties, supported by data on improved patient outcomes, reduced hospital stays, and cost-effectiveness, the department demonstrates its commitment to advancing patient care and its integral role in modern medicine. This approach directly addresses the feedback by providing concrete evidence of IR's value, fostering collaboration, and positioning IR as a key player in multidisciplinary treatment strategies, in line with the principles of efficient and effective healthcare delivery expected within the European regulatory framework. Incorrect approaches analysis. One incorrect approach involves passively waiting for referrals and only engaging when directly asked to justify existing services. This fails to demonstrate the proactive and innovative role IR can play. Ethically and professionally, it neglects the responsibility to advocate for patient benefit through minimally invasive techniques and misses opportunities to improve overall hospital efficiency and patient outcomes. From a regulatory perspective, it does not align with the spirit of advancing medical practice and demonstrating value, which is implicitly expected under frameworks like EBIR that promote excellence. Another incorrect approach is to focus solely on the technical aspects of IR procedures, without articulating their clinical impact or economic benefits. While technical expertise is paramount, a failure to translate this into patient-centered outcomes and resource optimization makes it difficult to gain buy-in from hospital administration and other clinical departments. This approach is professionally deficient as it does not effectively communicate the value proposition of IR in the broader context of healthcare delivery, potentially leading to underutilization and missed opportunities for patient benefit, which is contrary to the goals of modern medicine and efficient resource allocation within European healthcare systems. A third incorrect approach is to dismiss the feedback as a misunderstanding of IR's capabilities without further investigation or engagement. This demonstrates a lack of receptiveness to stakeholder input and a failure to adapt to evolving healthcare needs. Professionally, it can lead to interdepartmental friction, and a missed opportunity for growth and integration. Ethically, it prioritizes departmental comfort over potential improvements in patient care that IR might offer, which is a failure to uphold the highest standards of patient-centered practice as promoted by professional bodies like EBIR. Professional reasoning. Professionals should adopt a proactive and collaborative approach. This involves actively seeking opportunities to demonstrate the value of their specialty, using data to support their claims, and engaging in open communication with other departments and stakeholders. A framework for decision-making should include 1. Actively listening to and analyzing feedback. 2. Gathering evidence to support the benefits of IR interventions. 3. Developing clear, concise proposals that articulate clinical and economic advantages. 4. Fostering interdisciplinary collaboration. And 5. Continuously evaluating and adapting services based on outcomes and evolving medical knowledge, all within the established ethical and regulatory guidelines of the European Board of Interventional Radiology. Question 20. Market research demonstrates that interventional radiologists frequently encounter variations in vascular anatomy during endovascular procedures. When planning an intervention on the superior mesenteric artery, SMA, in a patient with a history of abdominal surgery, which approach to assessing the SMA's anatomy is most critical for ensuring procedural safety and efficacy, adhering to European Board of Interventional Radiology (EBIR) principles. Option A. Performing a rapid cursory review of the patient's medical record, focusing only on the primary indication for the intervention, with the assumption that standard anatomical knowledge is sufficient. Option B. Relying on standard anatomical atlases to confirm the typical origin and course of the SMA, assuming minimal deviation in this patient. Option C. A detailed review of pre-procedural imaging, specifically focusing on identifying the origin, course, and branching patterns of the SMA, and correlating these with potential collateral pathways and the impact of prior surgical interventions on the surrounding vasculature. Option D. Prioritizing the immediate selection of access sites based on the most common anatomical landmarks, without a detailed pre-procedural anatomical assessment of the SMA itself. The correct answer is C. A detailed review of pre-procedural imaging, specifically focusing on identifying the origin, course, and branching patterns of the SMA, and correlating these with potential collateral pathways and the impact of prior surgical interventions on the surrounding vasculature. Explanation. The scenario presents a common challenge in interventional radiology, the need to accurately assess vascular anatomy for a complex procedure, where anatomical variations can significantly impact procedural success and patient safety. The professional challenge lies in anticipating and mitigating risks associated with these variations, requiring a deep understanding of anatomical principles and their clinical implications. Careful judgment is paramount to ensure the chosen approach aligns with best practices and regulatory expectations for patient care. The correct approach represents best professional practice because it prioritizes a comprehensive and individualized risk assessment based on detailed anatomical knowledge. This aligns with the European Board of Interventional Radiology (EBIR) guidelines, which emphasize the importance of thorough pre-procedural planning and patient evaluation. By considering potential anatomical variations and their impact on access, navigation, and treatment delivery, the interventional radiologist can proactively identify and address potential complications, thereby optimizing patient outcomes and adhering to the ethical obligation of beneficence and non-maleficence. This approach also reflects the regulatory expectation for evidence-based practice and the continuous pursuit of improved patient safety. An incorrect approach that relies solely on standard anatomical descriptions, without considering individual variations, fails to meet the professional standard of care. This approach risks overlooking critical anatomical anomalies that could lead to procedural failure, vascular injury, or other adverse events. Ethically, it breaches the duty to provide individualized care and can be seen as a failure to adequately inform the patient about potential risks. From a regulatory perspective, it may fall short of the expected diligence in pre-procedural assessment, potentially leading to noncompliance with quality and safety standards. Another incorrect approach that prioritizes speed over thoroughness in anatomical assessment is also professionally unacceptable. While efficiency is desirable, it should never compromise the meticulous evaluation required for complex interventional procedures. This approach neglects the fundamental principle that patient safety is the primary concern, Regulatory bodies and professional standards consistently highlight the importance of adequate time and resources for pre-procedural planning, and a rushed assessment can be interpreted as a disregard for these mandates, potentially leading to adverse outcomes and professional repercussions. The professional reasoning process for similar situations should involve a systematic approach. First, a thorough review of available imaging, e.g., CT angiography, Mr. Angiography, to identify the target vessel and surrounding structures. Second, a critical evaluation of potential anatomical variations based on established literature and the radiologist's experience. Third, a consideration of how these variations might affect the planned interventional strategy, including access routes, catheter manipulation, and device deployment. Fourth, a discussion of these findings and potential implications with the patient, ensuring informed consent. Finally, the development of a contingency plan to address anticipated challenges. This structured decision-making process ensures that all relevant factors are considered, leading to the safest and most effective patient management.